So let's have a look at the anterior view of the human skull. As you can see in this 3D model, most of the view is dominated by the orbits of the skull and the nasal cavity. A very interesting thing is that how are these sockets where the eyeballs are housed and the muscles that move the eyeball and open the upper lid, how is this conformed? As you can see here, many different bones are involved. And yes, for the roof of the orbit is conformed by this concave structure of the frontal bone. And the floor is conformed by this inward projection of the maxillary bone. And the external walls of these orbits are conformed by the right and the left zygomatic bone respectively. But also the inner lateral walls are conformed part by the ethmoidal bone and part by the lacrimal bone, right and left, of course, because it's a paired bone. The ethmoid is a single bone. But also the posterior wall of this orbit is conformed by this sphenoidal bone, as you can see on both sides. So this is how the structure of the orbit of this bony socket is conformed by multiple bones that gives this nearly perfect shape where these eyeballs are located. But also we have another important landmark, which is the supraorbital margin, which is this line that differentiates the upper portion of the orbit, and that's what we call the supraorbital margin because it's on top of the orbit. And in this area we find as well the supraorbital foramen, which is this opening or indent which you will find just in the superior line of the orbit. And in this foramen is where some sensory nerves pass through to innervate, for example, the forehead. You will find as well the infraorbital foramen, which in this case is not part of the structure of the orbit. It's in the maxillary bone, as you can see here, but it's equally important because in these foramens it supply the passage for another bundle of sensory nerves which innervate the anterior face. Now let's take a closer look at the nasal cavity. The nasal cavity has a triangular shape, is divided by a nasal septum in the upper portion and the lower portion. In the upper portion, you will find immediately the perpendicular plate of the ethmoidal bone, and in the lower portion, you will find the vomer, which is another projection, bony projection just beneath the perpendicular plate of the ethmoid. Prominently, you will find as well the right and left inferior nasal concha, which are two lateral projections and which do not form part of the ethmoidal bone. But you will see here that you will find as well a medial nasal concha and a superior nasal concha, which in this case, these two are part of the ethmoid bone. If we remove the maxillary bone and the nasal bone, you can have a much better look at the ethmoid and the vomer, the perpendicular plate, the middle, the superior, and the inferior, right and left nasal concha. I'm not going to say too much more about the anterior view. Next video, we're going to study the lateral view of the human skull.